presentation. We will have a few polling questions to keep you interactive with it, and hopefully there'll be some time at the end for questions. We are also encouraging you to connect with all the speakers after the session via the virtual event platform. So on that note, we'll get started. And our symposium abstract said, "Who says crime does not pay?" And I think we've all seen the headlines in Canada. Healthcare cyber attack is the worst in Canadian history. Hospitals overwhelmed by cyber attacks fueled by booming black market. And Canada's hospitals must monitor cyber threats to avoid attacks. I think it's apparent to many of us in this space and across the healthcare system that the system is under attack and there is no end in sight. And there are real impacts. Appointments are being canceled, surgeries are being rescheduled, and patient safety is compromised by unscrupulous bad actors who steal health data and sell it or use it for blackmail. This is a direct impact on patient care, on services, and certainly on our vulnerable citizens. I think we'll all agree this is an important topic for today, and we're pleased to be part of this symposium. The topic is "Don't Let Hackers Steal Your Health Information, Tips on How to Improve Digital Resilience with Cybersecurity." If we could move to slide 3, I am pleased to welcome our 2 speakers. Jeff Buss is our CIO at Nordic Global, which is our parent company. And Jeff brings over 25 years of experience and leadership in cybersecurity. Before he joined us in 2020 at Nordic, he ran a system information and event management national practice at a large consulting firm. He has served as a cybersecurity advisor to 4 of the 5 large banks in America. And Jeff has held global leadership roles ranging from Chief Technology Officer for Cyber Development to Chief Information Security Officer at the US Defense Information Systems Agency. I'm also really thrilled to introduce you to Dr. Laura Copeland. She is a physician and she's also Healthtech's Chief Medical Information Officer. She's an emergency physician who is currently practicing in psychotherapy. She's also a certified change management practitioner. And Dr. Copeland, for those of you who know her, has been a physician and a medical informatics specialist for over 16 years, and she brings passion and enthusiasm to her role in the health informatics space. So on that note, I'm going to turn it over to Jeff.
Thank you, Christine. My name is Jeff Buss. As Christine said, I'm the CIO here at Nordic Consulting and at Healthtech. What Christine didn't say is I am from northern Wisconsin. So when I first started building this brief, I was talking to my wife about it. And I said, you know, what should I start with? And she's like, well, you can tell them you're almost Canadian. And I'm like, what does that mean? She's like, well, I mean, you spend 7 to 8 months of your life every year, every weekend at a hockey rink. Yeah, most Americans don't do that. I'm like, all right, that's fair. She's like, your favorite pastime is ice fishing. You bought a truck just so you don't have to smell your kids' hockey gear in the back. And I'm like, okay, fair. She's from Los Angeles, by the way. So, and she's like, you almost cried last night at the Oilers because the Oilers lost. And most Americans probably didn't do that. I'm like, oh, that's okay, fair, right? So Wayne Gretzky was there. So it was kind of a big deal. But anyway, so really excited to get a chance to talk to everybody today. And I want to thank you for taking time out of your busy schedules to do this. My goal today with the session is to give you some alternative ways to look at cybersecurity. I'd like to give you some tools that we found to be very helpful as you approach and maybe to bring back to your organization when the session is done. So we're going to discuss the current state of cybersecurity. We're going to talk a little bit about comparing banking and government and healthcare and how they approach cybersecurity. Then Dr. Copeland's going to go through a few scenarios where we're going to answer some questions that takes it more to a tactical level where we're going to talk about what can you personally do. And then I'm going to talk at the end a little bit about some tools and show you those tools that we use and how we use them. So with that in mind, I would like to move on to overview of cybersecurity. So, as I read the news this morning, right? So Costa Rica's, Condi is a Russian-based, hacking group that just took over had a breach in Costa Rica. So they took over the public health network there. So if you were to go to Costa Rica today, most of the clinics are shut down. So it's a pretty serious deal, right? So they also took over their social security fund. So it's paying out a lot of their folks there in the country. So Scarborough Health Network was a breach that happened last week in Canada. So there's a lot of really major breaches happening. And so ask the question, why, right? So The bottom line, on the slide is cyber threat actors continue to evolve, and healthcare spending on cybersecurity does not. Why? I think it's interesting. Healthcare finance suggested that healthcare's #1 financial issue is cybersecurity. That's a pretty bold statement, I thought. The #1 way to cut costs, they say, is to prevent a breach. So we're going to talk a little bit about that today, and how do you prevent a breach? Other industries like financial services spend about 15% of their budget of their IT budget on cybersecurity, when about 43% of healthcare organizations spend less than 6%. So it's a major mismatch of spending with a lot of the different industries out there, which creates some significant issues, right? So especially when you have massive vulnerabilities that continue to arise, like Log4j and SolarWinds. Ransomware continues to wreak havoc as a phishing. Phishing is the primary vector, right? So how do you stop phishing? When 34% of the healthcare companies suffered a ransomware attack in 2021, and they expect payments to increase fivefold, with only 8% of the companies getting that data back, which is kind of crazy. And then a breach, right? So the difference between ransomware is they lock up your data. A breach, they'll come in and they'll extract and pull your data out, right? So cybersecurity breaches hit an all-time high in 2021, with 45 million individuals affected by healthcare cybersecurity attacks, up from 34 million. That's a pretty big jump in a year. So pretty significant activity happening in healthcare right now. Let's talk a little bit about the spending in Canada and why it is what it is. So 66% of the organizations, Canadian organizations, expect their cybersecurity budgets to increase in 2022. The challenge is COVID, right? So hospitals are simply trying to survive. You've got massive, issues that have been created by the, healthcare demands of, all the nurses, all the different, shutdowns of surgeries, et cetera, which create financial strain on the hospital organizations, which in turn create strains on the cybersecurity budgets. So you can see that the intent is there. Red is Canada, and yellow is global. So the intent is there, right? So, and I think you'll find, the bottom sentence in particular, many breaches that we're seeing are still preventable with sound practices and strong controls. So what are those, controls, and how do we best approach them from a reasonable control and security perspective, is what we're going to talk about here in just a little bit. So with that, I wanted to talk a little bit about Canada and the healthcare system there. So in regards to cybersecurity in particular. So 39% of Canadian businesses, 34% of healthcare suffered a ransomware attack in 2020. 65% of them anticipated another ransomware attack in 2021. So significant, impact to the Canadian healthcare market for sure. The average cost to remediate a ransomware attack is about $2 million, and it's about $9.4 million, for a breach. So these are not insignificant fees, and that's not reputational damage calculated in there. So the state of Canada, the Cyber Center in particular, notes that COVID-19 does represent a significant issue, right? So and there have been a increased risk in cybersecurity. They recommend increased monitoring of logs, reminding employees to do phishing, and awareness in particular, and ensuring that servers and critical systems are patched for all known security vulnerabilities, right? Makes sense, and that is a good baseline. It's good to start. There's a lot more than just those three, and we're going to talk about a little bit more than just those three. But before we do that, I want to talk a little bit about the role of cybersecurity in framing it. So I want to talk a little bit about how does the government, and we lost the T it looks like on there, and banking and healthcare approach this differently than healthcare. So I come from the government side. I spent 25 years in the United States military, ended up at Fort Meade, Maryland, where we did a lot of the cybersecurity. We had about 3 million people behind our network. And we had a lot of breaches and a lot of different cyber activity during my time there. We also had the White House behind us. So we had a lot of people coming at us and attacking us, which sounds really cool until you're the guy that's got to defend it. And then it's not a whole lot of fun. But in the government, you're going to find there's 5 different warfighting domains. And that's a big deal for us, right? Air, land, sea, space, and cyber. We've got our own cyber command. And so when you're at Fort Meade, Maryland, like right now, for example, with the activities happening in Ukraine, you're going to feel like you're at war. And what does that feel like? So Stan McChrystal had on his in Afghanistan. Above his door, he had 1752. And I remember seeing, I'm like, what is that? Like 17 hours of work, 5 hours of sleep, 2 hours of working out. that's what being in combat 7 days a week for about a year, right, is kind of what the expectation was there. And you sort of feel that way when you're in the government. You feel like you're at war in cyber. So when you go to banking next, right? So banking, when I first started advising, some of the top banks, I found that very different paradigm there. Their paradigm is they're an IT company that happens to do banking. I say that again, an IT company that happens to do banking, which is a very different way to approach the problem. So cybersecurity was baked into their applications and how they approached literally everything, which I found to be very interesting. Their CISOs are very well paid and they're very highly skilled. So moving into healthcare, what I found was it's not necessarily an IT company that happens to do healthcare at all. It's still very much a provider-focused, approach, which I can appreciate. My wife is a provider, so I very much appreciate the approach. But I think what we're going to find going forward in the future is that's going to flip a little bit, and you're going to find more IT driving healthcare and enabling healthcare in certain respects. But I have found the level of funding, to be quite frank, between the three to be a significant gap, and it's a board level issue that needs to be addressed, right? So the bank's boards got it, right? They have a cyber expert on almost every bank. The government is full of the cyber experts on their advisory boards, but healthcare, I've not yet seen cybersecurity experts in many of the boards, which I think will help, solve the problem going forward. One other paradigm I wanted to kind of share. So 25 years in the military during a rather tumultuous time globally. So I have multiple tours of combat. And so this slide was built based on my combat experience. And my first, combat experience was, I was very compliance focused and compliance based. I wanted to make sure the aircraft I was flying, I knew everything about it, right? I knew the ins and outs and how to operate and how to, optimize my environment that I was in. My second tour, however, it flipped quite a bit. It was much more focused on risk-based. In that I learned the enemies have a vote, right? So that their TTPs, their tactics, techniques, and procedures really mattered, right? And when I started to learn, how they approach the problem, I started to then be able to adjust how I reacted to it. Then the third was resilience. My third tour in combat, it's more about how do we accomplish the mission? In other words, how do we make it through all of the ambushes and traps and all the other thing the enemy's trying to get after and really survive as a unit? So I put a picture of some veteran hockey players up there that survived, the war, came back with loss of limbs and whatnot. But the resilience piece there is significant to me because they got back up, right? They're back playing hockey. That's a big deal. So how do you accomplish the mission? So as I look at this in cyber, I see most of the healthcare, clients that we work with back in the compliance-based area, right? So I see the banks largely in the risk-based, starting to move in the resilience-based, and I see the government, all over the place. So some parts of the government are very mature, some parts are not very mature. But thinking of the evolution of cyber and how do you move your organization along that evolutionary kind of graph, if you will, I think is worth thinking about, especially at the board level. So I'm now going to turn it over to Dr. Laura Copeland to talk about patient, practitioner, and administrator scenarios. Laura, over to you.
Hey, so I am definitely a woman who has worn and wears consistently many hats. And so I'm going to put on a few of those hats today and ask some common questions from that perspective of the audience and trying to tap into some of your expertise and of Jeff. So we're going to go straight to our patient. And as our patient, I have to tell you, I am extremely motivated. I love all of the tools that I have, my little watch, my phone, my blood pressure cuff, my scale, it all feeds into my phone. And I have this amazing amount of data that I really want to share and talk to my doctor about so that I can do better. The problem is I go and I send it to my doctor in the app because you can email things to your provider. And then what happens? I get told off. You're not allowed to send us anything via email. It's not safe and secure. So my question to you, and we're going to go to a poll now. Here's my question. Hopefully you're going to see coming up on the screen a poll question. It should be taking up your screen and you can go ahead and answer. I want to exchange health information with my doctor safely and conveniently. So how should I go about doing that? Please put in your answers now. And I'll talk through this a little bit. I have to tell you, I get that anything I send in email could be on the front page of the newspaper or tweeted around the world tomorrow. I do understand that. What I don't understand is why anybody would care about my blood pressure measurements. And so, Jeff, I don't know, do you have any idea? Why does somebody care about my blood pressure measurements?
I think building a profile on people is kind of what they're trying to do, Dr. Copeland. I think PHI data in particular, you can sell on the dark web if you wanted to. And it's worth quite a bit of money, but you have to compile the data, right? So it's building that profile on that person that would have the information that you could then use to, do all kinds of things like, sell that information on the dark web, right? So, or you reach out to that person, potentially and gather information about them and use that to hack them, if that makes sense.
So they're basically trying to capture my persona and sell it so that somebody might be able to fish me better.
That's right.
Okay, interesting to know. And I think we're finished with our polling. And so the answer I'm hearing from my very informed audience is ask your doctor's office to open a patient portal. Jeff, do you want to comment and concur?
Yeah, no, for sure. So I think the patient portal is, HTTPS, it's a secure portal that allows, information to be shared securely, right? So email, as you look at these different answers, I think faxing information, sending in the mail, right? I think folks understand that is not as secure as a secure patient portal where the data can be secured both, at rest and in motion, which is good. So no, that is by far in this particular choice list, the one that you want to do.
Awesome. Well, let's go back to our next, our question. Our next persona. So our next persona is Dr. Arun Singh. And Dr. Singh is a health practitioner. He's a family practice doctor. And he's a little nervous now that he hears that he has to open up a patient portal because it seems like the requirements for health IT keep ballooning. And he's been very much on board so far with it. He was the champion of the EMR in his family practice office. And he wants to encourage this, but he's having a hard time just even managing day-to-day life with his patients. And it's because nothing is connected. So the EMR, you have to open up over here. And then, the video virtual platform is completely separate. You have to open that up over here. And then, our provincial information system, well, that's separate. So you're logging on over there and you're entering your own information and passwords and patient information so you can get the right patient up on all of these things. And then there are all these other things that comes up. If you want to have special drug permission, then that's another place to go and log in. If you're doing a WSIB claim, well, you got to go log in on this site. Passwords and management of passwords is crazy. And so Dr. Singh is trying to come up with some solution for his clinic. And we're going to go to our next poll, which should be coming up on your screen. Dr. Singh wants to know how can he securely manage these passwords? This is what he's focused on right now as a way of improving his workflow. And he's been looking at different options, but before he goes and invests in any, he really wants to ask your expertise. So hopefully you'll be entering information in the poll, which I can't see on my screen right now. Hopefully everybody else has on their screen. And yeah, I don't know if that's showing up all right for everybody. The poll didn't show, so we need to ask our AV folks. Please put up the poll for this. Yeah, okay. So we're going to try to launch the poll, but nonetheless, we've got Jeff. If we don't have all of you, we at least have Jeff. So some of the thoughts here: should we get a secure online password manager with multi-factor authentication? Should we just carry a journal and put our passwords in it? Because let's face it, nobody can hack my journal, at least without me knowing, I think. Should we have our computer save it in our keychains? Is that a possibility? Or should we not bother at all because passwords aren't secure, so who cares? So these are some of my thoughts. As a physician wondering what to do, and we're waiting for some answers. And I know that we got the poll up a little late there, so we're still letting folks participate. And
Yeah,
it
no,
looks,
the full results coming in, and I love it. Some people are putting "don't bother, passwords are not secure." That was my first answer back to discuss that. But so using an online password manager adds some risk, right? So using multi-factor authentication on top of it is quite a good idea, right? And we'll talk about multi-factor authentication here in just a minute. Don't be my dad. Carry a journal that gets still enable all your access, right? Have your computer save passwords and keychains. That's a good idea. However, if you get access to that computer, you can obviously hack into it. And don't bother, passwords are not secure. So that is probably most cybersecurity guys' answer or girls' answer would be, passwords are not secure. Program called Kali Linux that anybody can download for free comes with, free password, Jack the Ripper it's called, which does hashing, rainbow tables, and passwords, right? So longer, more complex passwords are key, right? So, and adding the multi-factor on top of it, just ensuring that your CISO or your CIO has multi-factor across everything and not just when you log into O365 or Google or whatever it is, i.e. servers.
so one of my big questions, Jeff, is if you're using a password manager with multi-factor authentication, one of the things we worry about here in Canada is the Patriot Act and having our data stored someplace out of Canada. Can you speak to that?
Yeah. So you've got two laws there, right? You've got the Privacy Act, or Patriot Act, which came out after 9/11, which allows Section 215 to be exact, right? So that talks about if a terrorist act, Americans can look at the data. PIPEDA, Section 73C also does something very similar, right? Which is you're allowed to share information back, but it's got to be based on a terrorist act that's been verified. So there is some ability to share information across, but if you have a password manager that's in the United States and the Patriot Act is embarked, could they get that information? Yes. But they would have to have reasonable cause. So there is One Password is the name of the company that's in Toronto. So I would encourage folks, if they're interested, that is would alleviate Dr. Copeland the concern there, as it's owned and operated by a Toronto-based company.
Okay, thank you, Jeff. So we're going to go ahead on to the next persona. But before I head that way, putting my practitioner hat on, or still wearing my practitioner hat, I have to say things are getting very complicated. And it used to be that as a physician, I could manage this in my family practice. But what I'm learning more and more, including from you here today, is that I probably have way more risk than I think in my private practice. And it's difficult to manage when you just have 4 or 5 physicians and a few other allied providers working together. So how am I supposed to manage this? I mean, I'm going to have to outsource. I guess that's one of my thoughts. I'm going to have to start hiring somebody to kind of look at the holes for me and help fill that in. And there's no shame in that. I do that with my accountant. So that's fine. I am concerned about the impact that's going to have on my overhead, and realizing that small practices like mine probably won't be able to continue to keep up and keep ourselves safe, which means we're going to be very dependent upon healthcare administrators to hold up some of this, which is why we're going to switch over to the hospital administrator role. And Renee Benoit, who is our persona for our hospital administrator, she's been in healthcare a long time, mostly on the practitioner side, but she's also been a director and chief operating officer for many years. And this is her first week as a CEO. And in some ways, this is like a dream. It's really exciting. In other ways, it's a complete nightmare, because she didn't really think she was walking into, being frontline in a war here. And her board is pressing her for how she's going to deal with this cyber threats. And she just doesn't feel like she has a lot of knowledge of how to spend this very, very small budget that is allocated to adequately defend her organization. Super stressful. Jeff, please help break it down and give us a cost-effective way of managing this. And let's ask the question here: how can I economically defend my organization? And we're going to go to this poll number 3. I don't know if we can. Yes, there we go. So I got to tell you, some days I think that the answer is just block all internal and external email, because this phishing is crazy. But I also get that maybe that's crazy. Buy more cybersecurity tools. Like, what else do I need to buy? And how much is it going to cost me? Outsourcing, like again, this expertise, the lack of expertise at each individual organization is certainly frightening. So how do I outsource some of this? And also, I mean, I get that I probably ought to be doing some regular security training for all my employees, but is that enough? And so looking at our polls as the answers have come in, I get, yes, I absolutely should keep up with that regular security training for my employees, but yes, maybe there's some value in outsourcing and getting some more tools. So over to you, Jeff, give me a plan.
Yeah, no, happy to comment on this one, right? So security training obviously is I believe to be the right answer here. Outsourcing your cybersecurity is going to increase your ability to economically defend potentially. But the security training, the number one attack vector is to socially engineer folks. An issue we've seen is people putting their phone numbers on LinkedIn, and then they'll get a text from some number in Toronto or wherever that says, "I'm your CEO. Could you please go down to the gas station and buy a bunch of these scratch-off cards, and then send me the code back? I'm in a meeting, so please do this immediately." Right? So, and that happens a lot. So that's just one example of doing the security training that will help alleviate some of those attacks. Outsourcing your cybersecurity, I would argue, depending on how you do it, if you're a small firm, you still have to do the same thing a big firm does, right? To meet the NIST requirements and ISO requirements and all these standards that are out there, as well as laws. So I find that most folks outsource a portion of their cybersecurity depending on what and how big they are. Buy more cybersecurity tools is it's a common approach. The challenge is the people side of that. It's like buying an F-18. You've got to know how to fly it, and they're very complex, some of these to fly, and I'll talk about that here in just a minute. Other questions, Laura, on this?
Great. No, Jeff, bring it on. I want to hear. I know you're going to dive into a deeper plan here on how to do that. So go for it.
And to answer the question, Don, it's 1Password is the name of the Toronto-based company. All right, so this slide was derived. So I'm going to try and give you some tools to kind of look at cybersecurity and how to gauge how well you're doing in cybersecurity, right? So one is this day in the life slide came about when Congress asked CISSA, hey, we would really like for you to tell us what you do for all this money that we spend with you. So the director asked me, hey, Jeff, we got this 500 slide deck. Can you make it 1 or 2 slides? Like, oh boy, okay. So this is a culmination of the entire IT organization at a very large organization, but it applies all the way down to small ones as well. So you've got 3 main functions, right? You build stuff, you operate stuff, and you defend it. So the building, what I found very helpful in this is we do every quarter, we do a baseline of these. So I watch the applications, for example, tick up, right? So if you got 7,000, or just say 700 or 7,000 applications, and it goes up to 900 or 9,000, you probably got to add more people because you're going to flip the applications over to operate. And then the defend side it flows over into the defend side as well. So you've got to operate and defend all those new things. So this is kind of the canary in the coal mine. So if you're adding a bunch of stuff in the build side, you should expect to add stuff on the operate and defend side, if that makes sense. One of the ways that I would check to make sure that organizations are working efficiently is I look at projects in work and projects in queue. And if you've got 500 projects in queue and you're working on 2, it means you've got a capacity issue, right? So, and your team is never going to get to those 500. So, looking at that quarter over quarter helps give you kind of a tracking mechanism for you to be able to figure out, are you being efficient and effective in the build side? On the operate side, number of users, physical devices, cloud resources, all of that, watching the growth. When I took over as the commander of the District Command Center in Fort Meade, my boss told me I got to do 2 things. He said, you got to beat 11060 and you need to intercept entropy. Didn't really understand what either of those were, so I went and looked them up, right? So CrowdStrike's 11060 is you have 1 minute to alert, 10 minutes to investigate, and 60 minutes to remediate, which is based on the Russians, studies that they've done, being able to figure out, and extract data in about 2 hours. So you've got, they cut it in half saying you should do it in 60 minutes, but which makes sense. I've not met many hospital systems that can do that, to be honest. The banks are challenged with it. It was a challenge in the government, but that is something to aspire to. Intersection of entropy, entropy is decay, right? So it's organizational decay. It's when you lose some of your key engineers and they depart, go somewhere else. That's entropy, right? So when you're watching that leave the organization, you've got to figure out how to backfill that, not just go, oh, we'll worry about that later. This is one of the ways that I use to help do that. So tickets down at the bottom for operate, right? So if you've got mean time to repair or mean time to fix the issues, of 10 days, that's probably not good. It means customer service is going to be great. So making sure you've got the manning and the skills to ensure that the ticket flow is down to a reasonable, less than 100 and less than 7 days type of queue. Defend, right? So defend is a big one, right? So this has grown dramatically over the past 10 years, 5 years, and 1 year, right? So cloud app, a lot of folks are moving to cloud. Cloud is someone else's server. It doesn't mean that it's going to come automatically configured to defend all your stuff. You're going to have to figure out how to do that, which is not super easy. Anyway, this is how many countermeasures have you deployed, how many security events, and how many alerts do you have, right? And again, I could spend all day just on this slide, but the alerts in particular, that's how I would measure, how many alerts do you have and how many countermeasures are you putting in? And if your alert queue goes way, way up and you can't handle it, it's a pretty good indicator that you need more people. Anatomy of security. Again, I could spend an hour on this slide, but this is taking a doctor's approach. This is the nervous system of how this all works, right? So I tried to break it down into 6 subcategories. Security operations, we would call that cardiology. Network security, urology. You just can kind of keep going through. These are very specialized fields inside of the cybersecurity industry. And in particular, just to call out the SIM, for example, security information event management, the second one in, people spend their whole career just in that particular technology. And that is like the brains of the entire organization that does the monitoring of all this for you. So it's a bingo chart, right? So number 1 is, do you have capability there? And number 2, do you have people there? So oftentimes when I'll go through, I'll look at spending on each of these 6 categories. I'll look at people and I'll look at technology, and then I'll say, here's your gaps. So this is a handy tool to use for understanding your gaps inside of security. So green is fully deployed, yellow is partially deployed, orange is not deployed, and then blue is what you're hoping to do the next year. It's great for briefing the board, it's great for briefing leadership, and it's great for just understanding what do you have in place. I left Microsoft in there for a reason, to give you an idea. This particular client used Microsoft across the board. They can do a lot of stuff. They spent about $20 billion on their architecture. AWS has spent a whole bunch too, but they're going after this entire environment, right? Which I imagine is going to happen in healthcare eventually with some of these big manufacturers and software companies. Building cyber resilience, and I know we're running out of time and I want to save some time for questions, so I'm going to go fast through this one. Building cyber resilience comes down to, it's kind of the evolved approach to looking at, this isn't just looking at risk, this isn't just looking at compliance, this is looking at how do I get back up after a punch. Tabletop exercises are a great way to do that. What I found in healthcare is a lot of times it's just the IT guys and girls doing it. So you don't have your CEO, you don't have your board, you don't have your legal staff there, which creates some significant issues. Because I assure you, when something bad happens, they will be in that brief. I'm going to skip over the Australian Signals Directorate Essential 8, but that is a great slide. If you want to click on that, it gives you the first 8. Let me see if I can go back there just for a second. It gives you the first 8 things you ought to do. Roughly 80% of the cyber attacks and attack vectors can be blocked by doing these 8 things. Application whitelisting, for example, you can only go where these, the list of things that you say you can go to, versus allowing anything minus the blacklist, right? So patching applications, operating systems, configuring Office macros. Application hardening means don't use admin for your server access, which we find a lot of. Multi-factor authentication has come a really long way in the past 24 months. Regular backups is awesome for ransomware, because if you have backups, you don't have to worry about ransomware. If you don't have backups, you do. Oh, I apologize. Looks like somebody else is in the slideshow here. External analysis is how they build profiles of companies, right? So this is like an Nmap scan or a network mapping scan that looks at what ports are open. Do you have email security in place, like DKIM and SPF and some of these basic security measures in place? And if you don't, they build a profile on you, and then when an exploit comes up, they can just inject that exploit and attack you. So you've got ransomware. I circle those 2, and data breach. So ransomware is if you're under 750, this score for this particular client, or I guess this is us, is 800. A company with 750, we are half as likely to have a ransomware attack as a company that's at 750. So, and we're half as likely to get a data breach as a company that has 700. So it's a pretty decent indicator of whether or not what is your external attack profile, and this is what the enemy sees and scans every day. So we're happy to do one of these for folks if they want to see one. They're easy and relatively, relatively give you a lot of knowledge for, for the bang for the buck. So Christine, I'm going to hand it back over to you for closing comments.
Yeah, sure. So next steps. If we could go to that slide, certainly we want to give you some meaningful actions that you can take away. On Monday, you can go through the 8 essentials that Jeff just walked us through and take a deeper dive into some of those in the context of your own organization. Certainly reach out to anyone at Healthtech or Nordic. I have Jason's email up there if you want a free external scan that Jeff was just talking about. But after that, it really is that bigger piece, that bigger planning piece. And as we've heard a few times here, if this isn't on the board in the CEO agenda, then it's something that needs to get on there. It needs to be something that needs to come to the forefront because of the risk involved. And it should be there at least quarterly. If you haven't started, then you need to start working on building a digital resilience strategy, and getting it funded. The cost of cybersecurity we saw at the very beginning of this is quite significant, and having a plan in place and being proactive and having it funded so that you can go about those actions in advance of ever having that risk is really important. Establish some metrics and some targets that you're going to report on to your leadership and to your board, and obviously monitor those risks to avoid attacks. So those are the takeaways from this. We are happy to open the floor to some questions. Certainly there's good conversation happening in the chat. Prevention is better than a cure. I think we would probably all agree with that. There's a balance here between the outsourcing, between the question that we had in the poll, 24/7, 365 coverage versus outsourcing is expensive. So I don't know, Jeff, can you speak a little bit to that balance that needs to happen, and how do organizations, come up with decisions for that? What is the best approach?
Yeah, I think if you look at the slide where I go over all those security tools, it's hard to, number one, buy all these, and number two, to orchestrate them all, right? So this is there's a lot of information, and again, some people are experts in just one of these boxes. So to outsource some of this to a company that does this for a living, I think is a good idea. But I think accountability and responsibility are two different things, right? So I would argue that you are still accountable to make sure that all of this information is culminated, that they're doing their job, and it's just not a fire and forget. You've got to monitor, and you've really got to pay attention to this. You can't just say, you guys do it, we're good. You've got to be involved, would be my only caveat to outsourcing.
Okay. I'm not seeing questions. Feel free to put questions in the chat. We probably have a few more minutes here, but just as we're waiting, what are the biggest challenges with cybersecurity threats today? And maybe you can speak to the global world where we are, and what should we be paying attention to, and what is the main areas we should be focusing on? And I think you highlighted it during your presentation.
Yeah, no, I think you covered a lot in that question. Sorry. So I think the main things folks ought to be looking at is getting reasonable security measures in place, right? And going beyond just getting the basics and looking at things like, hey, how do I become resilient? And thinking about it a different way, instead of going, I just need to get the minimum in place and I'll be good, right? Because oftentimes the folks that do that find that they're not good, right? And then they get really frustrated when they get hacked. And you're looking at big numbers. Those are 30 to 40% of companies are getting ransomware a year, right? So you stack that on top, and eventually it's just a matter of when. So understanding that you're probably going to get hacked is probably, it's not a fun thing to think about, but it's better to think about it now than it is after you've been breached. So my biggest recommendation would be go back to the resilience slide, and focus on, hey, how do I build resilience across my organization? Because without building the resilience, when you get hit, you're going to be in panic mode, and it may take down the company, as it has, thousands of companies across the world.
Right. Maybe one last final question then before we do a wrap up.
I was just going to add in there. I was just going to add in there that there's definitely a clinical side to that. I don't know that we certainly have some exercises where we practice downtime for a brief period of time. But I think recognizing that downtime can sometimes be a very extended period of time, and that's a very different story for us and for our patients. So I would recommend practicing some long-term downtime test runs, or hopefully not actually experiencing it, but definitely pretending, so that we know what we're doing if something like that happens, just from a resilience perspective.
Right. Maybe, and thank you for that, Laura, very important. One last little question. With people working from home, obviously through COVID, that has been the norm. Are there special considerations to be working from home that organizations and everybody needs to consider?
Yeah, I think so. I think VPNs have come into their own, right? I think Microsoft is, again, I don't want to be specific to an organization, but I think some folks have done a really nice job, of orchestrating, work from home. Like we're on a Zoom right now, right? So some companies have invested a lot there, which I think is great, right? So I think from a home security perspective, separating your home computing from your work computing is a big deal. Not everybody's gotten there yet, but I highly encourage that because you don't know when you're going to click on your AOL email and all of a sudden it's got a ransomware and it's going to lock your computer up on your work computer, right? So, and you don't want it to do that. Or worse, you're going to, you use the same password for your AOL account as you do for your work account, and then they're able to get into your work account, and then there's a breach. So separating those two environments would be something I would highly encourage folks to do. And something, again, comes in the basics of, cybersecurity, I think, and something that's changed pretty dramatically over the last 2 years. Right.
Well, thank you very much to Jeff and Delora, and thank you to the audience and the participants in this particular symposium. It has been our pleasure at Healthtech to bring this forward to you. I do encourage you to connect with us via the virtual event platform as we continue with eHealth in 2022 for this particular conference. We have been asked to encourage everybody to go over to the day one closing host session, which is happening in 3 minutes. So if you could go over, that would be great. If you need to know how to navigate there, if you go to your agenda and you look up the agenda section of your platform, you'll be able to navigate to the host closing session for day one. Again, thank you very much. We look forward to participating in eHealth and happy to receive any questions you may have for us via any of our people here in eHealth or through the platform. Thank you very much.